Former President Joe Biden has been diagnosed with prostate cancer. This finding coming after the 82-year-old did report some symptoms, and that led to doctors discovering a nodule on his prostate. And joining us now is Dr. Matt Cooperberg, the professor and co-leader of the prostate program at UCSF. Thanks for being here, doctor.
Pleasure. How are you?
I'm great. I wanted to start with this question because now that we heard all of this yesterday with the former president, what do you think the conversations people should be having with the men in their lives about screening or getting tested to catch prostate cancer sooner before it spreads? What should people be talking about at home with their loved ones?
There's an incredible amount of chatter and noise around the story, of course, on that exact question. The reality is, prostate cancer screening is incredibly effective. The PSA test is very likely the best biomarker we have ever had in the history of oncology for screening for cancer if we use it well. So men should absolutely get a baseline PSA test, ideally in midlife, between age 45 and 55 or 60 is the best time, because PSA is prostate specific, not prostate cancer specific antigen. So as men get older, other things that happen to the prostate can cloud the picture. So getting a PSA in midlife, at which time it should be under 1 in terms of the number, the value, is an incredibly effective way of ruling out prostate cancer for the majority of the population. And then we can focus efforts with imaging, other diagnostic tests, biopsy, for men who are actually at risk based on the PSA.
So starting at age 45, you should start to get tested. I think that's important for people, guys, to know here, because when it's caught early, prostate cancer is pretty survivable.
Very much so, very much so. The majority of people that get a diagnosis of prostate cancer will outlive it. One of the cliches is you die with it, not of it. But the minority of them that are aggressive, and this is the situation President Biden is in now, the minority of them that are aggressive do still kill more men than any cancer except lung cancer. So finding it when it is confined to the prostate and identifying the ones that need treatment is extremely important.
So how serious is the former president's cancer? They had said it was pretty aggressive.
Yeah, I mean, there's few details that are sort of in the public domain. We know it is a Gleason 9, which means it looks aggressive under the microscope to the pathologists, and we know that it is out in the bones. But we have a new test called PSMA PET, which is identifying much lower volumes of bone disease than previous tests like bone scan were able to do. So this could be anywhere from just 1 or 2 spots to it sort of being everywhere. And that's a big difference in the prognosis. If it's in the first category, where it's just 1 or 2 spots in the bone, this has not been treated before, he hopefully has many years in front of him.
Yeah, so what are the treatment options, and is it different based on his age, and that it also, they're saying that it is spread into his bones?
Yeah, if it's not in the bones, then we have surgery, we have radiation therapy, focal therapy, which is just treat the tumor, leave the rest of it alone. Once it's in the bones, then our focus is more on control than cure. It is uncommon that we can cure a prostate cancer that's in the bones, even if it's only 1 or 2 spots. So in that situation, the mainstay is hormonal therapy, which is medication to drop the testosterone level down, without which prostate cancer will shrink and regress. That can control it for years. And then beyond that, we have 10 new medications in the last few years, all working on different aspects of cancer biology, many of which, by the way, are the result explicitly of federally funded research over the last 20 years into prostate cancer, and the efforts of companies beyond that initial federal investment in biology to figure out how to go after these cancers. So the list of options and effective treatments for this cancer is exploding, and that's very, very good news for men with advanced disease.
And when you have an advanced stage of prostate cancer, what does your life look like? Are the symptoms so hard that it makes it really difficult to continue on? Like, how do you go on from there?
Men live with this for years these days. You know, the end stage, you know, people that die of prostate cancer at the last months of life are difficult. It's painful, and it can cause a lot of problems in terms of urination, et cetera. The years leading up to that, though, even for men that have advanced disease in the bones, it is manageable. The treatments that I mentioned, hormonal therapy and other treatments, they do have their side effects. It can cause fatigue, it can cause changes in metabolism, things like that. But men live relatively normal lives for years with metastatic disease. It's a very different diagnosis today than it was 10, 20 years ago, on average.
Well, I'm so glad you could join us. This is Dr. Matt Cooperberg, a professor and the co-leader of the prostate program at UCSF. So I'm glad you could answer our questions, and I hope guys starting at age 45 will start to get checked for this based on your advice.
Got a PSA. Pleasure.
Thank you.